What is the problem with the human resource in terms of getting people to work? Because we see, from the health committee perspective, why is it so difficult to just hire doctors? We can see us getting doctors from Cuba, and yet we have many doctors here. Why has it been a problem to just hire doctors?
For all human resource, you see, you even have had programs where the government is involved, where we are organizing for health workers to go and be employed elsewhere. And at the same time, you hear that in our own facilities, not here, you know that in our own facilities, there's shortage of nurses. Now, it is the management. It's the management of health human resource. Now, in this country, the health human resource is probably the most complex human resource you can have, not only in this country, across the world. If you look at health workers, you will start with, there are nurses there, you have clinical officers there, you have doctors there, you have pharmacists there, you have radiographers there, you have physiotherapists there. All these are people who have specific trainings. They are managed they were managed before in a unitary system. Now we devolved. Now when we devolved, this management structure, some of them actually have not devolved as should have. Now let's just talk about the recruitment of doctors. That I can talk about that, for example. Yeah. They are trained, and when they have trained, you have interns. Now interns are assumed to be still in training, but they are working. Now that is actually under national government. That when they complete, now they should be employed in the facilities. Now then they are now going to, that is county governments. And there is no good, smooth transfer. I think they are working on it now. That is not happening. But if we just leave that, let's go into their organization. All these cadres I've talked about, they are well organized. They have regulatory bodies, the bodies that regulate them, their training, their registration, their conduct, and so on. These are actually national. They have unions, which are actually national, and they have associations. So each cadre has those three. Those are still national in structure, but we have not recognized that when they are dealing with them. So it gives us a lot of issues. Now, if you look at the Public Service Commission and the County Public Service Commission, again, you don't have a smooth transition. We have not worked out a smooth transition. If you have nurses and they are employed in one county, are they employed on exactly the same terms, or they are different terms? Are they transferable? Their training, when they are working, people still get trained when they are at work, particularly health workers. Is it the same across? Are they being managed in the same way? Are they transferable from one place to the other? Because these are now individual employers. So those are issues that has given us problems. The other one is just actually managing them and recognizing their needs. Look at what COVID showed, that health workers actually needed protection. They started dying, and they needed the protective gear. These were not available. They needed insurance. They also have health needs. So when they are sick, how are they treated? Now those things have not been looked at. So to a large extent, in my view, the problem is the management of the health human resource. Now we have tried at the health committee, but remember the health committee deals to a large extent with the national health at national level. There is a health committee in the Senate. Where we are is in the National Assembly. Again, we have tried to actually sometimes come together to see how we can do this. There is the intergovernmental relations structures that again should be brought in, and I think they have tried. So to a large extent, it is management. There may be also issue of finances. Can we employ all of them? And what are the salaries that we gave them. You gave the issue of the Cuban doctors.
Yeah.
Actually, I think if you worked out what they were being paid, is definitely much higher than what the local doctors. We were ready to get that, but that I think was a political decision. And let me say it was kind of a knee-jerk reaction, that if the doctors here don't want to work, we can get some from elsewhere. It has been tried before. It has never worked. Management of the human health resource is problem number one.
Okay. Davji, where does the problem lie from the union perspective in terms of human resources? What is the problem?
I think the first thing is that as long as we are looking at healthcare as an expenditure rather than investment, then we'll continue having a lot of problem in terms of human resource. When you look down a few years before devolution, the doctors used to graduate every year and be absorbed to different facilities in the country. But after 2016, then when the governors came in and became more aggressive in terms of wanting to employ, then the reduction in employment increased almost 100-fold. To this point, I will say every year we have about, in 2015 up to about 2019, almost 600 doctors were being churned from different universities and being licensed. But then in 2019 and up to 2020, the numbers has increased to almost 1,000.
Yeah.
So when you look at overall in the country, in the last 5 years, you have about almost 4,000 doctors that have graduated. But if you look at the numbers that have gone into employment in either public or private sector, you realize about less than 20% of that number have been employed in both private and public sector. So there's a big number of doctors and a big number of nurses, a big number of clinical officers that have graduated and are not really employed to offer services. But then when you go to the hospitals, you realize that there's no services because there are no healthcare workers in those facilities. And one reason that why this happens is because the implementers of healthcare in the counties, that is, I would say the MCAs, the governors, even the senators, and even the MPs, and even the executives, the CSS and the CECs, they are not consumers of the same healthcare that they're giving to the people. So most of the times they will go for PR actions and try to show that there's an existence of an hospital when there's anybody with a lab coat, and even if they're not doctors or they're not nurses or they're not clinical officers. So that's, I think, one of the failures that we've seen. So that's, I would say, a PR aspect, mostly in the counties. Number two, the county governments have been claiming or have been stating that the expenditure monthly expenditures for within the budgets goes up to 32% of their county budgets into the healthcare. And so with these, they have been unable to employ healthcare workers in many of the counties. And that's why one of the proposals that we had from the Athia Nations, other People's Health Movement, with Amnesty, with all other CSOs, together with doctors' unions and other unions, was that if that is the case, then there's need to increase this budget to 50%, so that there could be services by employing healthcare workers to offer services in those facilities. Okay. And then the national one also should be increased to 15% as per their budget declaration of 2001. Yeah. Also to ensure that there's actually employment of the workers, because you will not say that you want to have services where we do not have those particular workers in the hospitals. Okay. So that's been the biggest challenge and the biggest complaint from the county government. But the ideal solution to the issue would be to have a centralized management of human resource, that is, having health service commission, whereby the counties will just be asking this particular body that we need 50 doctors, we need 100 doctors, we need this number of clinical officers, we need this number of nurses, without considering the budgeting aspect of it, but with an aspect of ensuring that they're offering the services that they need to offer to the people. I think that would be a better solution to the issue of human resource.
All right.